I'm Gail Bataille, and I was the Director for Mental Health Services in San Mateo from 2000 to 2008. The family movement was very strong in San Mateo County. There really wasn't a peer movement or a consumer movement that was strong in San Mateo. But because of my work early on, I was really an ally for the consumer movement in California.
The things that they need are support with really defining legitimate roles for the new employees, and this was groundbreaking for us. We hadn't had that role in the system. One of the most exciting processes I've ever been really privileged to be a part of.
And so it was just always a commitment that I had and a real kind of passion that I had. We did things like we had the first Consumer Speaks conference in like 1981. We had to develop a consumer academy just to, teach skills and provide a space where consumers, people with lived experience could see each other, connect with each other, be with each other, support each other.
I'm Louise Rogers, and I'm Chief of County Health, but I've been with the county more than 20 years. In my first role, I came as the Deputy Director of Mental Health Services. One of the things that Gail and I realized when we started doing the work, the architecture for people to exercise influence was lacking in the government.
One of the things that systems always struggled with was how come we're not reaching the people we're supposed to be reaching? And no wonder, because the system wasn't set up to be inviting. Creating a more responsive, peer support, friendly system begins to break down those barriers.
My name is Jay Africa. I am the current Director of Behavioral Health in San Mateo County. The reality is most of our systems are super complex to navigate. And so it's really important for somebody who have navigated the system, experience the challenges, be there, at your side to tell you, this is how it works. These are some tools that you can use because I've been there and this is how my experience can help you. When you feel like that person understands you because they've gone through a similar experience, that definitely builds trust, lowers the fear and the anxiety, and also increases the confidence that somebody will understand the challenges that you're experiencing.
A peer support worker to me is someone who can harness their lived experience and their journey effectively to ignite hope in another person.
Peer support, I would think of as the provision of outreach and services and support to people who have mental health and substance use concerns or problems by individuals who have lived experience, who've been there themselves and have learned and come through that experience and have something to offer to others.
Hi, my name is Eric Santos, and I'm a peer support specialist with the Office of Consumer and Family Affairs. Having mental health or addiction issues, there's a stigma involved with that, I know from first-hand experience how that stigma can affect your life. Being able to be there for people and have them see that you understand more than just empathize with them, but actually have lived their life, their context. I think that's really important because it's easier to trust someone when you know that they truly understand, not only have lived in your shoes metaphorically, but actually have truly lived in your life, similar circumstances.
I think it's critical to understand people's experiences, the challenges navigating a complex system, the stigma that people face, the barriers that make it hard for people to walk in the door. You feel understood. There's a sense of mutuality here, of a shared experience. It's scary to get services, but when somebody that you feel understands your culture, your context, it feels a little bit better. Maybe feeling not judged at all.
Trust is the foundation that we build all relationships on. And if our organization can't send a strong message about why we should be trusted, we will fail in the entire enterprise of engaging people in the services that we provide. People who have lived experience are really the foundation of that trust.
Their vulnerability of telling their own stories, their own journey, what's painful oftentimes, what usually are secrets, allows them to connect with people in a very, very different way. And more importantly, destigmatize the notion that mental health or substance use is a bad thing. It's just a part of our lives.
Peer support work, I think, is critical to providing services to people who have mental health and substance use problems, in that peers can understand and reach those individuals in a way that professional staff often can't in a mental health system or in a behavioral health system. Engagement is essential, and peers really are impressive in their ability to engage.
There are many, many patients whose recovery journey probably would not have been ignited were it not for engagement by a peer.
Isn't it just amazing that every day when you go home and go to bed, you think about, oh, what did I do today that helped somebody to change their life for the better? And I feel like peers do that every day.